Hi, my name's Chad Brown, and I'm going to be conducting my head-to-toe examination for Nursing 320 at West Virginia University, Parkersburg. Unfortunately, I could not get a room on my unit as we are full, so I'll be doing this in my living room today. I'm going to start by walking into the room and introducing myself to the patient. Hi, my name's Chad. I'm going to be your nurse today. I'm going to start with orientation questions, and of course, as I mentioned in my neurological examination, we're going to be watching for the way that the person carries themselves, the way they speak, the way they react to my questions throughout, as well as performing the actual physical portion of the examination. So can you tell me your name?
Robin Brown.
Okay, and do you know what today's date is?
12/3/22.
Excellent. Can you tell me your date of birth?
January 22nd, 1965.
Okay, do you know what county we're in right now?
Kanawha.
Wonderful. So we've decided that this patient is alert and oriented ×4. I'm going to move ahead with the physical portion of the examination. And I like to start top to bottom and group as much of this as I can together. So I'll sway a little bit from what the normal, here's the abdomen, here's the chest and lungs, eyes, etc. So I'm going to start at the top of the head. I'm going to inspect the scalp and palpate here, make sure that we don't see any type of shingling or any type of infections. Everything looks good there. So I'm going to move on down and palpate the musculature and the temporal pulses here. Those pulses are strong. Muscles feel tone. I'm going to stop at the temporomandibular joint. Can you open your mouth for me, please? One more time. Excellent. We feel no popping or crepitus there, so that's great. I'm going to, while I'm here, go ahead and move towards the eyes. So, ma'am, would you mind removing your glasses for me for just a moment? Excellent. I'm going to start by checking pupillary response, and that gives me the opportunity to look at the pupils as well as look at the conjunctiva and the mucosal membranes around the eyes all at the same time. So if you wouldn't mind looking straight forward for me. Okay. And we are seeing Perla here. Also, I'm going to look, like I said, at the mucous membranes. Everything looks good. We see no inflammation or any kind of redness or anything like that. Now, do you feel any discomfort or pain when I rub on you here?
No.
Okay, and as I'm doing that, since I am palpating, I'm going to go ahead and move to the nose as well and palpate there. Any pain or discomfort in your nose as I do this?
No.
Okay, and how about here around your mouth?
No.
Okay, excellent. So with that, we've knocked out a little bit more of the head than you would if you were just moving straight down. So now I'm going to test oculomotor function. Can you follow my pen light with your eyes while keeping your head straight? Excellent. All right, perfect. Now I'm going to test visual fields. Can you tell me when my hand becomes visible in your periphery?
No.
Okay.
No. No. No.
Wonderful. And now I'm going to test visual acuity. Can you tell me how many fingers I'm holding up?
2.
Okay. How many fingers I'm holding up now?
2.
Okay. How many fingers I'm holding up now?
8.
Wonderful. All right, you can put your glasses back on if you'd like. So we have already visually inspected the majority of the face. I'm now going to move to the ears and the nose and the mouth to make sure that we have patency, that we don't see any sort of inflammation or anything like that. So if you wouldn't mind, just lean your head back just a little bit for me. Okay, and both nares appear patent, no deviation. Can you open your mouth for me? Okay, stick out your tongue. All right, say ah.
Ah.
Okay, I'm going to lift back your lips here, so we're going to take a look at your teeth and gums. Excellent, gums look great. There's no inflammation or anything there. So I'm going to move over to the ears now. We're first going to check the ears with our light and make sure that we see patency, no excess earwax or anything like that. And we do not. So now I'm going to test audio acuity by whispering a word into the patient's ear and having them repeat it to me. Can you repeat this word for me?
Green. Apple.
Okay, excellent. So now we've gone through the majority of the face. I'm going to check a couple of the cranial nerves. So would you mind smiling for me? Okay, and frown. All right, lift your eyebrows for me. Okay, and squeeze your eyes closed. Excellent. Now, while I was doing that, I was also checking for symmetry of the face. We don't see any facial drooping, anything that would indicate any type of neurological problems or stroke. So I'm going to keep going on with the cranial nerves now. Can you push up on my hands? Wonderful. And can you push against my hand to the left? And push against my hand to the right? Excellent. So now we've done that. Can you now turn your head all the way to the left and the right? Excellent. Perfect. So now I'm going to have you turn your head all the way to your left and leave it there for me. Okay, that's your right, but that's fine. So I'm going to come over to this side. And now, so I'm trying to visualize the thyroid now. Turn your head to the right again for me. Excellent. We don't see any excess visualization of the thyroid or any bulging here. So I'm going to go ahead and palpate the carotids. And as we all know, but it bears repeating, don't palpate the carotids at the same time or you will knock your patient unconscious. We don't want that. I'm going to start with the right here first. Excellent. Start with the left here now. Wonderful. Mom, here I'm also going to check the trachea, looking for any sort of deviation. We see no tracheal deviation. So now I'm going to come to the back and I'm going to palpate the thyroid. Doing the same thing that we were trying to do when we were visualizing, just making sure that we don't feel any enlargement or anything like that. We do not. Now, if I had a normal hospital bed, I would put the patient at a 45-degree incline and check for JVD. We're just going to pretend that they're at 45 degrees right now. Can you lift your chin up for me just a little bit? Excellent. We see no jugular venous distension here at all. Everything looks good there, so we've got no indications of atherosclerosis in that. So that looks good. So we have the patient sitting up. I'm going to go ahead and move to auscultation on the back here first, since it is, we can do the anterior laying down, but the posterior one the patient sitting up for. So I'm going to get out my stethoscope and I'm going to check lung sounds starting at the top, patient's top left. I'm moving a zigzag pattern down the back, listening to all lobes of the lungs. All right, now if you wouldn't mind, just take some deep breaths for me. Excellent, and all lobes of the lungs sound clear. Now, as a classmate brought up in a previous discussion post, it is important to listen to your patients, both breathing deeply and breathing normally, to make sure that we're not masking any types of sounds. But for the purposes of this, I'm just going to keep moving so that we don't waste any more time, because this is going to be a long video to begin with. Now, I've already listened to the posterior for the lungs. I'm also going to listen to each side bilaterally to make sure we don't hear anything different there. So same situation. Would you mind just taking a couple deep breaths for me? Okay, wonderful. And as with the posterior auscultation, all lungs do sound clear there. Now, since we do have the patient sitting up now, I could ask the patient to lay on their back and then do some further auscultation of the chest. I'm going to first check range of motions in the arms so that we don't have to ask the patient to get up again, just making things easier for everybody. So can you hold your arms out directly in front of you? Okay, now can you bring them to your side? Excellent. Can you lift them straight over your head? Wonderful. So we appear to have full range of motions of arms there. So that is perfect. Can you go ahead and lay on your back here? And at this point, of course, we could move to doing some of the neuro checks, some of the strength test checks. It's really what makes you and the patient the most comfortable. Since I do have my stethoscope out, I'm going to go ahead and listen to the heart and the stomach and auscultate there. So that way I can get past the auscultation stage and move back to just palpation and then testing of the muscular features. So I'm going to put this on. I'm going to check the 5 regions of the heart with both sides of the stethoscope, with the bell and the drum. Okay, wonderful. So I've listened to all the valves of the heart. That also gives me the opportunity to listen to the lungs at the same time. So I've now listened to the lungs anterior and posteriorly and listened to the valves of the heart. While I was doing the valves of the heart, I'll also put my right hand on the apical pulse. So you can kind of group all of this together to make this easier for the patient and quicker for you. So we check the apical pulse, valves of the heart, and the lungs all at once. Everything sounded great. We heard no bruits, no whooshes or anything that would indicate a septal defect or regurgitation, anything like that. So now I'm going to move into the abdomen. I'm going to listen first for abdominal sounds in all 4 quadrants, and then I'm going to palpate. Okay, excellent. So we have active bowel sounds in all 4 quadrants of the abdomen. The next thing I'm going to do is palpate in the 4 quadrants, and just tell me if there's any kind of pain or discomfort through here, please.
Okay.
Any pain or discomfort?
No.
Okay, and everything feels soft and non-tender. Excellent. You can go ahead and sit back up since that doesn't look too comfortable. Would be much easier in a hospital bed, but
Yes,
you know, here
definitely.
we are, unfortunately.
Okay.
Okay, so now we've gone through and done our auscultation of pretty much everything that we want to auscultate in the upper body. So I am going to now, with the patient sitting up and we've checked our lung and heart sounds, I'm going to palpate the patient's rib cage and chest and check for symmetry in breathing. So again, just take some breaths for me. Excellent. We have full symmetry across the entire abdomen, indicating that we don't have any problem with lungs, collapsed lungs, anything like that. Same thing with up here. We're going to do the same thing in the chest. Excellent. Okay, wonderful. So everything in the palpation inspection of the chest and the abdomen looks great. So I'm going to go ahead and move down to muscle tone and musculoskeletal across the entire body. Now we've already checked the range of motion for the arms. So, and we'll check range of motion for legs standing up or laying down, either way. But I'm going to do the palpation first, and we're going to check for any pain, tenderness, anything like that across the rest of the body. So I'm just going to move down through here, and we're going to squeeze on all the main muscles. Now, while we're doing this, we can also check a variety of pulses. So we could stop right here and check our AC pulses. Okay, as we move down, again, inspecting for any more tenderness, we can stop here and check our radial and ulnar pulses. Wonderful. Move on down through the thighs and the knees, and we can stop here again and check our popliteal pulses behind the knees. Any pain or discomfort?
No.
Okay, we're going to check our popliteal pulses. And we're going to move on down the legs here, and we're of course looking for any amount of edema or anything like that as well. We can check our heel pulses and our dorsalis pedis pulses. Wonderful. We've got no tenderness, no pain. We've got pulses at all of our pulse sites. So musculoskeletally, we look good for the moment. We're again going to check range of motion in a couple minutes. Now, since we've already done the arms, I'm going to go ahead and move to testing capillary refill and strength in the hands. So can you squeeze my hands for me? Excellent. Can you push away from me? Okay. Pull me towards you. Okay. Now put your arms up like this. Don't let me push you. All right, now don't let me pull you. Excellent. We appear to be at full strength across both arms. We don't have any weakness on either side. So I'm going to do the same thing with your feet now. So push up on my hands with your feet. Excellent. Push down for me. Okay, now don't let me pull your legs towards me. All right, now don't let me push them back. Excellent. Okay, so we've gone through all that. So now I'm going to check cap refill. So we're just going to squeeze and make sure that we have cap refill less than 2 seconds. We do. Excellent. And it appears equal bilaterally. Check your hands as well, please. Okay. We're squeezing the fingernails. Looks good. Cap refill less than 2 seconds. Excellent. So now what I'm going to do is I'm going to move to some of the neurological tests. So I'm going to check sensation. I'm going to check fluidity of movement. So if you wouldn't mind, close your eyes for me. I'm going to use this Q-tip, and I'm going to touch you on one side of your body, and I would like for you to tell me which side I'm touching you on. So I'm going to start at the top and move down.
Right side.
Okay.
Right side.
All right.
Left side.
Okay.
Left side.
Wonderful.
Left side.
Okay, perfect. Thank you. So sensation appears to be intact. Now, as I've brought up in my neurological exam, I like to do the sharpness test with just a closed pin. If you want to get more in depth, we can do things like the NIH stroke scale and whatnot to try and quantify a stroke, but as our patient is not exhibiting any signs of neurological damage, that's something that we're not going to do today. So I'm just going to test to make sure that pain sensation is in place. So I'm going to take this, and again, close your eyes for me, and can you tell me where you feel me kind of poke you with this pin here?
My hand, my left hand.
Okay,
My right side.
Okay.
My left.
Okay.
My left face. Right face. Sorry.
Okay. Well,
Right
we
side.
might see some. We might have to do a little bit
I
deeper
need
investigation here.
taught on right and left.
All right, excellent. So we've gone through the majority of that physical portion. So now we're going to be testing the fluidity of movement and stereogenesis. So the first thing I'm going to do is I'm going to have you hold out your palms and close your eyes, and I'm going to draw a shape in your hand, and I want you to tell me that shape. I'm going to start with your right hand.
Circle.
Okay.
Triangle.
Excellent. Okay, so stereogenesis is intact. Now, can you can open your eyes now. So I want you to take your finger and touch it to mine. Now I need you to touch it to your nose. Okay, and I want you to keep doing that. I'm going to move my finger left and right.
Okay.
Excellent. Can you do that with your other hand, please?
Okay.
Wonderful. Thank you so much. Okay, now, and this might be kind of hard sitting down, so go ahead and lay down for this one. What I'm going to have you do is I'm going to have you take the heel of one foot, touch your toe, drag it back to your knee, and then take it down.
So touch my toe.
Yep, and then just drag it, so you can do it like here,
Okay.
and drag it up your shin to your knee and then back down.
Okay.
Excellent. And you want to do that with the other foot, please? Just on your shin there. Yeah. Excellent. And what we're testing for here, again, as we talked about in the neurological assessment, is just fluidity of movement, ability to follow commands, ability to put the things where they want to put them. So you can set up for me if you don't mind. Okay, so now we're going to test range of movement of legs. So we can do this starting in the sitting position. We can also do it standing. Here, can you just put one leg out in front of you? Okay, can you lift your other leg up? Okay, can you put one leg down? And put that leg down as well. All right, perfect. Now with that, we can do a variety of things. We can have the patient stand up and touch their toes. We can have them basically do anything that indicates that they can move at the hip joint and the knee joint as well. We've seen this patient move already. We know that she has full control over those faculties, so we're not going to have her do that. The last thing that we're going to check here is gait. So would you mind standing up for me? We're going to stand on the opposite side of the room. We want the patient to walk towards us and then away from us, and so we're looking for any kind of distinctive changes in gait pattern. So can you just walk towards me? Excellent. Thank you. Can you walk away from me? Wonderful. All right, and there's one more test that we're going to do here, and then we're going to make sure the patient is comfortable, that their call light is in place, they have any drinks that they want, and we'll be back in a little bit to potentially do some more tests or administer medications. So the last thing that we're going to do is the Romberg test. And so what I'm going to need you to do here is close your eyes and stand in one spot. And with the Romberg test, we're going to be looking for to see if the patient sways forwards, backwards, left, or right. Excellent. And we see no swaying of the patient. All right, wonderful. So everything looks great. You can go ahead and make yourself comfortable. We're going to, of course, put their bed in a position that is comfortable for them, raise them up to wherever they can breathe and see their television show. Whatever it is they're watching. Make sure their call light is in place. Ask them if there's anything else they need, and then exit the room. So is there anything else you need?
Nope, I'm good. Thank you.
All right, excellent. Thank you very much. We'll be back in a little bit.
Great. Thanks.